Thank you, everyone. Today we're going to have Abigail Horn speak from USC about foodborne disease and COVID-19, namely applying network and data science to model, understand, and prevent large-scale diseases, a very relevant topic right about now. Abigail Horn is a postdoc at USC and a member of the Center for Applied Network Analysis, or CANA. Her research interests include network epidemiology, probabilistic modeling, and data science in the context of public health, with a focus on foodborne disease and diseases of diet. She received her PhD from MIT and a BA in physics from the College of Creative Studies at UC Santa Barbara. Prior to joining USC, she led a research project at the German federal level Food Protection Agency to develop, implement, and evaluate algorithms and decision support systems for modeling food supply networks to identify the source of large-scale outbreaks of foodborne diseases. Her work has been funded by the NIH, RWJ Foundation, Bayer, the German Research Foundation, and the Santa Fe Institute. With that, let's have Abigail speak. Thank you.
Thank you very much, Keith. And let me start by sharing my slides here. And let's see. Can everyone see that?
No.
I cannot. I think do you have access to screen share?
Yes, I think I needed to start with that. Okay.
Yep, we can see your screen now.
Great. All right, so yeah, thanks for the introduction, Keith, and thank you for the invitation to take part in this seminar series. It's an honor to be part of the seminar series, and I also just wanted to acknowledge everyone for who's listening to this right now. Thank you for making the time during this week, which has been an unprecedented week in our campus's history, our city's history, and even our country's history. So thank you for being on this. So the way I am going to give this talk, I'm going to talk through 3 different projects that have some interesting similar themes throughout all these 3 projects. And they involve network and data science, and they involve modeling and trying to better understand and prevent large-scale diseases, so both infectious diseases and chronic diseases. And so I'm going to get started by talking about some of those infectious diseases, foodborne disease. And so this is work that I have been developing over a number of years to model the network structure of the food supply system in order to trace the source of foodborne diseases. And this is work that I began during my PhD and that I continued in Germany, as Keith mentioned in the introduction. I worked with transport and logistics researchers at Kuhne Logistics University, as well as I actually spent a year at the German federal level food safety authority, which is kind of a cross between the CDC and the FDA, but focused on foodborne diseases. So I have a really great team of collaborators in Germany that I continue to work with. And so I began this work, I was in the US, but around the time when I was starting my PhD, I was witnessing the large-scale outbreak of E. coli spread through contaminated sprouts. And this outbreak, it probably seems really small compared to what we're witnessing now, but it was thousands of deaths that were spreading in a very short period of time. The outbreak was spreading through Europe, and there were even cases imported into North America through travel. And despite this large scale outbreak, it was taking investigators a really long time to identify the source. And so if the outbreak was identified, meaning we knew something was happening at the beginning of May, it wasn't until a couple, 6 weeks later that investigators were able to start identifying the possible source. And it wasn't until 2 months later that they were able to confirm the source, which was a small organic farm in northern Germany. And this is definitely not the investigators' fault. It's an extremely complex problem, and there's a lot of, the way that this investigation happens, there's a lot of data collection, there's a lot of records, manual collection of records and investigation of these records. And so witnessing this whole process, I started thinking along with my advisors in the PhD, until we have a system where we have this entire supply chain traceable through electronic ledgers, are there ways that we can use different sources of big data and emerging modeling techniques to reduce this source identification timeline? And notably, this whole system, this is a complex system. The food system is an extremely complex system, and it's, I would say, an under-modeled system, largely because it's such a complex system, and there are so many disparate sources of data. But that aside, it is this large complex system, and approaching the system requires a network approach. And so if we have a network model of the supply chain, we can model the spread of the diseases, of the foodborne diseases spreading through the supply system. And so that is what we do. So I'm going to talk about our approach for doing that. And the approach involves these different components. So it involves first modeling the food supply network structure as the substrate over which the outbreaks, food is distributed, of course, and over which then an outbreak of contamination can spread. And then we can develop methods to identify the food vector source, which is, for example, in the sprout case, the sprouts. And early in that investigation, something I didn't mention, but there were a large number of different food items that were being compared for which one was the source of the outbreak. And the investigators were able to identify it as sprouts, but that takes some time. And then the last part, which is identifying the location source in the sprout network. So starting with the modeling the food supply chain network structure. So the approach that we take to this is so it's an extremely complex, massive system, and we don't have a fine-grained model of how this entire system works together. And again, we might at some point, once blockchain or something like that becomes fully available through the supply chain, but we are definitely not there, and we're not there yet. And so the way that we approached this problem was to take a spatially and industrially aggregated approach, where we look at these different layers of the supply chain, the different sectors of the supply chain, so agriculture or production, processing, trade, and consumption. And we look at spatially aggregated, so we have spatially aggregated nodes that represent regions where each of these sectors have their processes occurring. And then we bring in a number of, we have a way of modeling all the different combinations between the food products that are consumed. So I'll talk about that in a minute, but the data sources that we use to inform this. So we have a number of different data sources on production locations and volumes. We use agricultural and industry statistical data. For import export, we use customs data. And then for the cross-regional transport flow data, we have shipping and shipper survey data that's available in Germany and the US. And then for consumption, we have retail revenue data. And so this is, we have a modeling process then to capture the way that all of this interacts. So this is, I'm going to break down the modeling process a little bit. So we have these connections between the commodity categories. And so I can actually just show you a network diagram of what that looks like. So the different commodity categories that we model are based on the data that was available when we were developing this model. But it involves these different, most of these food items aren't just produced independently. It's an interdependent supply chain where different components of one kind of food item are used in production of another food item. So we first start by identifying the relationships between these different food items in this network. And then we can model the flows across these different food items and the spatial regions and the sectors of the supply chain. So this is like a highly dimensional network model of the food supply system. And the way that we model these links is through a gravity modeling approach with a calibration step. And so in just a few words, so our gravity models in a few words. So we have the basic premise of the gravity model in kind of the more economic literature is to assume that the probability at which two entities trade is proportional to the production volume, the consumption, or the demand volume, and the distance between those two. And so the real feature of the modeling approach is in determining what set of parameters for these different, we have these different layers that we've just been talking about. So like the connections between the regions and the food categories and the actors, we have all these different numbers of gravity models, but all of the parameters have to match up, and we have this distance deterrence factor, which is going to be different for each food item. And that distance deterrence factor is informed through a calibration approach. And the calibration approach is to take these different supply chains, we have a different gravity model for each of these sectors of supply chain. And then we change, it's an iterative algorithm to identify the best beta and other parameters that work for this model, where we fit a set of gravity models for these different sectors of supply chain and regions, like I was just mentioning. And we compare that to transport data on observed freight distribution between regions. And so in Germany, we use federal transport infrastructure plan data. In the US, there's similar data that would come from freight analysis frameworks and commodity flow survey data. But this data essentially is, this survey data gives us flows between regions across sectors of the supply chain. And so we can fit our gravity model, our set of gravity models to this data that encapsulates these sectors of the supply chain. And we do this using this iterative fitting approach. So that's all I'm going to say about the food supply chain model for now. So going forward, let's assume that we have a working model of the food supply chain network structure. Once we have that, we can develop methods to identify, like I mentioned a few slides back, the food vector source and the location source of the outbreak that has spread along that supply chain network. And I'm going to start by talking about the location source, even though that's later, that's the last step in the investigation timeline. But I have to talk about it first because the method for identifying the location source informs our method for identifying the food vector source. So starting with this problem, identifying the location source, let's assume that we have a network, we have this working network model. And let's assume that we actually know what the food item was over which the contamination spread. So this is the sprout network or the vegetable network, which is what we had for Germany, because we don't have a, we didn't have specific data on sprouts in particular. So we have this working network model of the food item that carried the contamination. And then the network source localization problem is to say, given this network and given the observation of illnesses reported in association with specific locations where the contaminated product was purchased and consumed, can we develop a probability model that helps us determine what is the probability that any feasible source was the true source of the outbreak? And can we identify the highest probability source out of that distribution? So this network source location problem, we are not the first to approach this problem. There are a large number of approaches in the network and the computer science literature specifically, but we have this paper where we categorize the existing approaches to this problem in terms of why these approaches are not well fit to the foodborne disease context. And I'm going to talk about this. This is just to show, that if you're interested, you can look at our paper and look at all these different methods and in terms of this problem, but I'll talk about a few of the key aspects first. So first of all, food distribution itself, so the way that food is distributed through the supply chain, this is a network diffusion process. And I differentiate this from what a large number of the existing approaches to the network source location problem are focused on, which is an epidemiological contagion process. So one of the key insights in our approach to this problem is that foodborne contamination transmission is largely not a contagion process. This is to say that food, as it moves through the supply chain, isn't actually cross-contaminating a lot of other food as it moves through. So it doesn't, it's not that it doesn't at all. For packaged products, it doesn't at all. It stays within that packaged product. But for loose leaf or mixed products, contagion can happen, cross-contamination can happen, but it's really a second order effect. So we can model this entire process without a contagion model. And so that's all I'm going to say for that for now. And then another key important factor that we have to incorporate in our approach to modeling this problem is that food distribution, and therefore the way that contamination spreads through this network, occurs across multiple candidate paths. And so what I'm showing here are the connections, the top 15 connections between the source of the outbreak, which is at this farm in northern Germany, and Frankfurt, which is, which is Ulsen, is this location in northern Germany, and this location in Paderborn, where there was a large cluster of cases. And we can see that over this shorter distance, there was one supply chain, there was one path that was, made up by a number of sub network links, but one path that carried most of the flows through this network. But then when we look at longer distances, for example, from Hamburg or Ulsen, which is near Hamburg, to Frankfurt, there are a large number of paths of similar probabilities. So we can't just assume that the contamination will travel through one path, like the shortest path. We really have to be able to consider all paths of all lengths and probabilities. And so we've developed an estimator for the source location that's based on this random walk approach to account for all paths of transmission through the network. And so this is essentially a Markov transition process, and it's an absorbing process because we have the food supply will travel through the network and it will end at the place that it's consumed, right? So this is an absorbing Markov process. And we can then estimate the source location using a maximum likelihood approach. So, or we could take a Bayesian approach if we had information about the prior probability of the source location. But in the absence of any information about the prior location, we take a maximum likelihood approach to say, to estimate the likelihood and the maximum likelihood over all possible sources. And we get a nice closed form source estimator that that involves this random walk model for the source location, and that in doing so accounts for all possible combinations of paths of travel through the network. And we applied this, of course, retrospectively, because it took many years to develop this whole approach, to the 2011 outbreak of E. coli and contaminated sprouts. And when we do apply our method, we're able to identify the source location as in the whole region around the source location and the source location itself within the top set of spatial regions that are modeled by our supply chain network. So this map shows the probability distribution colored according to the peaks of this bar probability distribution, which is what we get. And notably, we're able to do this beginning as early as week 2 of the data that was available, that would have been available as of week 2 of the outbreak. Whereas, of course, it takes much longer in reality to actually trace back. So we don't, so there's, I would in no way say this, actually solves the ability to identify the source, but it supplements investigators' ability to do that by providing extra additional data that they can use to help inform their early hypotheses about where they can look for the source location. Okay, so that is the source location, the source localization approach. Oh, right, the time-based source identification. So all of that was just using the weights, the weights along the network based on the volumes of, or the flows of food through that supply network. But you might have been thinking, what about the times over which this outbreak spreads, and how can we use the times over which the outbreak spreads in the developing spatial picture that we have of the outbreak at various times, and what that means for the actual appearance of these contaminations in the supply network, with what we know about the times that it takes food to distribute through the supply chain at various stages. And so we have actually developed an estimator to do this. And I'm not going to talk about this in detail, but we have, we develop a Gaussian model that assumes Gaussian time delays through the supply system. And we can add these delays through each stage of the supply chain together and get this, and model the entire transmission process through this multivariate Gaussian random vector. And that allows us to estimate both the maximum probability start time of the outbreak and the likelihood of the source given that maximum probability start time. And so this is, and we even have a nice methodological contribution with this approach, which is to account for all paths of transmission through this temporal approach. I'm not going to get into that now, because actually I think this is really interesting, but when we apply this to our food supply chain data, there's actually just too much uncertainty in the system, in our understanding of how food supply, how the food moves through the supply system, for us to be able to use this temporal approach to better specify our knowledge about, or our inference about the source location. So all of these uncertainties compound as you add these probability distributions, and that gives us this very large uncertainty overall, and that uncertainty is too large to be able to use the times, at least with the data that we currently are able to get, to better specify our the source location. That all being said, I wanted to make a quick tangent to say that the temporal approach for source detection does have nice applications to other kinds of source detection problems that involve a large diffusion type spread of contamination, say a global pandemic that's spread through the air traffic network. Okay, so now I've talked about identifying the location source. I'm going to talk about identifying the food vector source, which, like I said earlier, was the sprouts or the vegetable network. So the problem here, or the way that we see this problem, is given different network models of the food supply system, how do we identify the food vector source in this system? And so we have these different network models. So I talked about earlier how all of these different food items may be connected through industrial interactions, but we can also model each of these different food items through its own network structure. And each of these different food items has a different characteristic network pattern. And our insight to this problem is to see this as a network model comparison problem, and to use the information to use our model of the transmission process through the supply chain, combined with this network structure, to say which food network, combined with that transmission model, best supports the observed outbreak distribution, or can best explain the observed outbreak distribution. And so I'll remember this from a few slides back. This is the bar probability distribution over the sources. So there's actually a lot of information in this bar distribution and this probability distribution, and we measure the amount of information in this distribution to look at the degree to which the food network could have explained the observed outbreak pattern. So on the left, I'm showing you the match between I'm showing you the bar, I'm going to say PMF, the probability, or it's PMF, the probability mass function that results from applying the traceback estimator to the vegetable network, which was the true network that spread, over which the contamination was spread. And on the right, I'm showing you the probability distribution resulting from the applying the traceback estimator to another network, another food item network, the egg network, and using the observed outbreak distribution. And so on the left, we see that there's a lot more structure, and the right, less structure, much less structure. This probability distribution is much closer to a uniform distribution, which would entail the absence of distribution. And there are a number of different metrics for characterizing the structure of the distribution. So just if looking at the distribution alone, we can measure its entropy or its variance. And then if we're comparing two distributions, we can use different distance measures like the Kullback-Leibler divergence. But one of the key insights that we've had in studying this problem is that we cannot just compare each of these, we cannot just compare these probability distributions from these different network structures one-to-one. And the reason for that is that each network has its own, we call it characteristic signal, which is determined by the specific distribution probabilities and densities of those networks. So just to explain why through a little example, so on the top here, I'm showing you again this network for the vegetable, the network of the vegetable network. And this is a much more, at least in Germany, a much more localized supply chain where there are a large number of farms throughout the country that are producing these products, and the supply is much more local. And then on the bottom, I'm showing you the network for red meat items. And this supply is, there are a fewer number of large scale producers, and they produce this and distribute it throughout the country. And so you can imagine that no matter for this, where's my cursor? For the supply chain, there we go. for this meat product that is supplied through the, with a few number of sources or producers and just disseminated through the entire country, there are a lot, for any outbreak distribution that you see, or for any pattern of contaminated nodes that you see, there is likely going to be a source explanation in that network. Whereas in the network that's much more localized, you're going to see not every single outbreak pattern is going to be explainable by a single source. And so that kind of, for those kind of reasons, each network has its own characteristic signal, whether you're sampling a random set of nodes in that network and applying the traceback estimator to that random set of nodes, or if you're simulating an outbreak on those networks. So so in our approach, we've had to develop a measure of, we call it the signal strength, which is the the structure of these distributions that is relative to both, the upper and lower bounded probability distributions resulting from that are possible to result from each possible network. And so this idea of the upper and lower bounded PMF, so we can think of the lower bounded PMF as that, which is kind of like a null model, which is what would result from a random set of nodes that's just sampled and tracing back the outbreak on that random set of nodes, or by taking the network structure and doing a random rewiring of the links in that network and tracing back the outbreak on that random rewired version. So those form lower bounded PMLs for each network structure, but there is also the upper bounded PMFs, which is what is the maximum probability, what is the maximum difference that we would see between these different probability bars. And so we need to develop a measure that is relative to both this upper and lower bounded PMF situation. So I should have advanced this slide earlier, but here I'm showing you a lower bounded PMF, not the ultimate lower bounded PMF, but a lower bounding PMF for the vegetable network, and an upper bounding PMF for the vegetable network, which has a lot more structure than if we look at the lower bounding PMF for the egg network, which in general has, even for a simulated outbreak, has less structure than that for a simulated outbreak on the vegetable network. And so we have to do that, we do that a large number of times at each point in time. So we do that as the information from the outbreak increases and we have more data points to do this traceback on. But even at each slice in time, we have to do this upper and lower bounding. We use a large scale simulation approach to do this upper and lower bounding approach at each slice in time. And so this is what gives us our confidence intervals at each slice in time, and we bring that across the outbreak as the number of cases continues. And when we apply this method that has been kind of relativized to this upper and lower bounded PMF for each network structure, we can use some of the distance measures to compare the different networks after these have been relativized. And then we can apply it, and when we apply it to the vegetable, when we apply it to the 2011 EHEC outbreak, E. coli outbreak in contaminated sprouts or vegetable, we're able to identify vegetables as the network that had the greatest, showed the strongest signal of agreement. It's important though that there are some other network structures that came up as, also likely possible sources, and that is due to similar in those distribution patterns for those networks. So this is, again, not a method that can in any way replace the current approaches, but it can maybe help inform the investigation process as investigators prioritize where to start, as investigators prioritize where to look. So I'm gonna go through this quickly, so this is all, you know, we develop all this approach, all of the applications that I've shown you so far has existed on this network structure that ended at this layer of consumption. But this is missing a key part of the problem when we come to tracing back foodborne diseases and our foodborne investigation process, which is where the actual illnesses came from. And so we're connecting these illnesses to this consumption layer based on where individuals live. But there's this entire last mile of the food supply chain that incorporates the links between people where they live and all of the locations where they could have consumed the contaminated food. So this was missing in this was a key feature that was missing in our modeling approach. And so we recently did some work to add to this model by adding in this last layer of the last mile of the supply chain. And we did that using travel survey data. Okay, so this is good data that exists in Germany, a very well done representative sample across a large number of households, and it includes demographic details and so on. But it felt remiss not to bring in other sources of data that could be used to help define the stage of the supply. And so we started doing that by bringing in credit, by bringing in credit transaction history and smartphone geolocation data. But I started doing this work and just really felt like there were just so many other opportunities for modeling, for disease modeling when it comes to diseases relating to food supply and using these digital sources of data at the last mile of the supply chain. So really this digital trace data opens up a whole new world of possibilities for modeling these flows, for modeling diseases and that are related to consumption behavior, food consumption behavior. And so this is a big part of why I came to USC and came to work with Professor Kayla De La Haye in preventative medicine to refocus this food supply chain modeling to address chronic diseases of diet. And so the work that we do, so now I'm transitioning to the next part of the talk, which is this chronic diseases of diet. And so this work focuses on modeling food environments and food access. And food environments that's the name for these spaces, the physical and also the social spaces in which people acquire and consume food. So we've all probably heard of the concept of food deserts and food swamps. Food deserts are areas where there isn't access to census tracts or some spatial designation in which there isn't access to healthy food options. And food swamps is the opposite, like this picture I'm showing you on the right, which is actually like the US, this is Figueroa corridor. This is, if you Google food swamp, this is what Wikipedia picture, this is the picture Wikipedia gives you, which is around USC. And so it's the saturation of these low quality or low nutritional quality food outlets. So there's this big characterization of the importance of individuals living in a food desert or a food swamp in terms of influencing their dietary choices. But there have been still like very inconclusive findings when it comes to relating the picture of the food environment with the actual observed nutritional dietary behavior and resulting health outcomes. And some of the limitations that we can point to in this kind of work are that they really focus on these static features of people's home environments. They're normally based on small scale studies, and they don't involve fine-grained detail about how, where, and when different populations access and use these food environments across these large, diverse populations. And so yeah, that's what I just said is what we don't know are the how, where, when these diverse populations access and use food environments. But what we do know is that the lack of access to healthy food is concentrated in specific demographic groups. And I'm showing you on the right data for LA about how lack of access to healthy food or food at all is concentrated in specific race, ethnicity groups. So this is where we see that digital trace data can provide a unique lens into these complex questions. And so a project that we've kind of just begun, we have some pilot funding work on, this is work with Kayla De La Haye in preventative medicine and our collaborators at MIT Media Lab. We're using smartphone mobility data to study how these diverse populations access food. And so we have a panel of data that's shared by Cubic. This is pre-COVID data, although we will also update this with COVID data, during COVID data. But in our pre-COVID data, we have mobility traces from 700,000 LA residents over 6 months. And we can use this to get objective measures across this large number of people of access to food environments and visits to food outlets at and importantly beyond the home neighborhood. And so this opens up a number of different opportunities when we combine this mobility data with point of interest database data like what are the food outlets, and what categories, what type of food, and how nutritional those food outlets are. And we can combine this also with health data, health prevalence rates of different diet-related health conditions. And we can use this to model the patterns of food access, we call it food foraging, and map social encounter networks and how these impact food access patterns, and how this all relates to, of course, the built environment that people live in. And so just as so this is preliminary work that we've just begun, but we're already seeing getting some pretty big findings. Like when we look at visits to fast food outlets, well, so this isn't really a key finding yet. This is just kind of I guess, sanity check almost, you can say, where we show that the visits to fast food outlets were more common among certain demographic groups as observed in our mobility data, which falls along the same lines as the prevailing knowledge in health research. But the more key finding that we've seen is that these visits to fast food outlets were not predicted by features of the home neighborhood that these individuals live in. And so what this means is that the hypothesis that people visit fast food outlets more often if or because they live in food swamps, areas that are saturated by a high density of low quality food outlets, that's not supported. So it's not as simple as living in that location and having a lot of access to low quality food to food outlets that is influencing their behavior. It's a much more complex problem, and we're gonna have to dig into that. But just to show, so when we talk about this, living in this area, we can draw a buffer around someone's home neighborhood and look at, the density of fast food outlets in that neighborhood. And we can look at the percentage of visits to fast food outlets inside versus outside that buffer. I've shown here just for illustration, a 1 kilometer buffer. We can increase the size of that buffer to different sizes. But what I'm showing you here on the bottom is the histogram of the number of visits to fast food outlets outside minus inside the buffer. And it has this distribution has a mean at 0, meaning on average across the entire panel of users in our cubic sample, there are an equal number of visits inside and outside the home district. And importantly, this kind of behavior holds up across these different demographic groups. Sorry, I think the resolution of this isn't that high. So I say this as preliminary findings because there's a lot more that we have to do to dig into what we're actually seeing here. And so on the left, I'm showing you some early results where we've taken this kind of observation where we look at the visits to fast food outside versus inside this home buffer. But we've broken it down to actually look at differences across this distribution. So what is causing, who is at this part of the distribution and who's at this part of the distribution. And when we do that and we apply some clustering to identify different groups, we actually are able to cluster it very well into these different types of groups. So groups that have most of their visits outside the buffer, an equal number of visits inside and outside the buffer, and most of their visits inside the buffer. And so we actually, to really understand what's going on here, we're going to have to analyze who these different people are that compose these different groups, what demographics and what are the activity patterns that are distinguishing these different kinds of visits. So on the right, I'm showing you some work that's been done by other researchers. This is on the bottom, this is some interesting work done by Marta Gonzalez and her team, where they identify different activity patterns for individuals based on their credit card transaction history. And they're able to see these different sequences of transaction from food to bank to home and so on. So they identify these key different sequences. And this is something that we would want to do is what is the context around someone's visit to a food outlet? Did they come from dropping their kids off at school? Did they come from going back and forth to see a friend or to work? What are the key different activity patterns that distinguish these kind of visits? And can that help to explain what type of food access behavior we're seeing? So that's our work with our growing work with the smartphone mobility data.
Hi, Abby.
Yeah.
Can I ask a quick question about when you showed the analysis looking at demographic data like education, did you treat like education like an ordinal variable, like bachelor's, master's, PhD, or?
Yeah, good question. So we looked at, this was one specific just binary variable of whether or not the prevalence of college education.
I see. I recall some interesting findings of like going from master's to PhD actually does not increase income or creditworthiness. So now I'm curious whether going from master's to PhD like also does not increase your likelihood to not eat fast food or be healthy and stuff.
Yeah.
Wouldn't be surprised.
Yeah, that would be, so that's why we really need to break this down further and get into some of the more nuanced insights, like answers to those kind of questions.
Thanks.
Thank you. Okay, so I want to mention some of the work that Andres and I have, Andres Abiluk and I have been working on together along with this great program of the, oh shoot, what's the acronym stand for? The data science collaboration with the projects with the data science master's students. And so Andres and I have been working on this for the last year, and we've been trying to see what kind of insights we can get about access to food environments and dietary patterns from social media data, namely Instagram, and from restaurant menu data. And so I think this is, I'm not gonna get into details here because we're still kind of in the preliminary stages of this work, but there's a lot of potential here for adding different for example, some of the work that we started doing, which is looking at restaurant menu data to help do a better job of categorizing food outlets by their healthiness. And so just to say a few words about this, traditionally the way this is done in the public health literature is we look at visits to specific kinds of outlets, like food outlet, like fast food, and grocery being a catch-all, and the idea being that that's a place where healthier food can be accessed and consumed. But there's a lot more fine-grained detail, and so something that we've kind of started doing is using restaurant menu data to categorize the nutrition of different of the average menu items at a restaurant, and using that to characterize the nutrition or the healthiness or unhealthiness of a restaurant. Okay, so I think I'm not going to have much time here, which is okay because we have a website, but this is the last part, which is our, so the bigger picture here, that I've been talking about work in disease modeling and talking about work involving health disparities. And COVID came along, we couldn't not combine the knowledge and the expertise that we have in these different areas to model COVID. So this is work that we've been doing over the last couple of months together with Dave Conti in biostatistics, who I actually haven't met in person because this entire collaboration has occurred since COVID, but it's been really great to work together. And Wendy Kozin in preventative medicine, and also together with the Los Angeles County Department of Health, who've been really fantastic in sharing data and answering a lot of our questions. And I'll link really briefly to our website, but we've developed an LA specific COVID model that addresses the questions of when will the peak of the epidemic occur and how will it impact healthcare capacity? What happens to the dynamics of the epidemic when social distancing is reduced, or when it starts to decrease to levels before the pandemic, like what's happening now. And then our specific focus has really been on how will the epidemic affect different at-risk and different race ethnicity groups. So this is, what I wanted to point out here is that we have really developed this local LA model, and we have a number of different parameters of this model that are informed by local sources of data. And so the features that I really wanted to highlight are this time-independent, factor of reduction in R0, which is based on mobility data, the proportion of cases of illness that are detected versus not detected, which is informed by seroprevalence or antibody studies that have actually been done by members of USC faculty, Niraj Sood in public policy. And then these risk probabilities, the probability of hospitalization given illness, of ICU admittance given hospitalization, and death given ICU admittance, which come from a combination of risk of early COVID study data and of local LA prevalence data. And so that was all I was saying in this slide. But we can combine these various sources of data to form our LA model. And I think I have to end my show,
so much, yeah.
And also I'll just show the site, because the idea is that everything is, the site explained itself, but we have these different projections by risk factors, and I wish I had saved more time to explain this, but we do projections for these key variables about the epidemic projections, like the hospitalizations and the ICU admittances, but also the deaths. But again, our key contribution is really analyzing these across risk factors and across race ethnicity groups, and being able to look at, based on our model of how the different risk factors contribute to the epidemic spread, what does that predict about the rate of the risk of death that we're seeing for different risk groups, and how that compares to this kind of ongoing discussion, this national discussion about how death rates are seem to be much higher for certain demographic groups, especially African American groups. So please take a look at our website if you're interested. But just to conclude my presentation, I just wanted to say that, you know, this modeling, I've shown a few different examples of modeling using novel emerging data sources, and hopefully being able to show that this really has the ability to make a large impact on some of these really huge, important, complex problems in public health. But to make this practical and tangible contribution, it really requires bringing in local and nuanced sources of data and expertise, and working across disciplines and partnerships across disciplines and sectors to facilitate this work. So I think that all of this lends itself to really interesting collaborations between the kind of work that we do in preventative medicine and the work that, and your expertise at ISI. And so, you know, I've already been having some really interesting research collaborations or conversations with some of your community, and I hope that we can continue that. So I have food ? I didn't really leave much time for questions, but I hope that if you're out, anyone's interested in continuing the conversation, please feel free to reach out at any point. So.
Thank you, Abigail. Yeah, let's give an internal round of applause or something. So because it's already at 3, and I know we're cutting into into your time, or into the meeting time, is there anyone who has one brief question for Abigail? All right, then one.
Well, how about, hi, this is Christina. I was just wondering what explanation you had about people traveling outside of the zone, the one that you were talking about, you know, combining cubic data with food swamps. So do you have a hypothesis that that explains the findings?
So the finding, namely that we don't see that access or that saturation of living in an area saturated by a higher number of fast food outlets explains the actual fast food behavior. And our hypothesis for that is that it's not simply a function of what food you have available to you in your home neighborhood. It's really your entire mobility pathway throughout your day. This is in pre-COVID times when we didn't just spend all of our time in our home neighborhood or in our home, but you spend time around your workplace, you spend time around the different places that you have errands throughout the day, or you have different activities. And so our next stage of work is going to be looking at what are the access to fast food and other types of outlets in all of these, your entire mobility pathway that you have throughout the day, and not just the outlets that you have access to where you live. And the hypothesis is that when you look at the entire mobility pathway, you'll see a stronger, that will help to better explain the relationship between access to food and the diet that is observed.
Or I'm going to propose an alternate hypothesis. People who live in places that have many more fast food type places, you know, maybe they can't just afford eating in those places. You see a strong negative correlation between income and fast food, but that might be explained just by there are fewer fast food places in wealthy neighborhoods. And so within poor neighborhoods themselves, you know, like income might not, you know, there might be opposite relationship with income. You know, more income maybe makes people more likely to eat at their local fast food restaurants, but most people who live there can't really afford to go out to eat.
Yeah, that's a really interesting hypothesis, and we can measure this in our data. The prevalence of, or the density of fast food outlets. And we have spatial data on the economic features of individuals living in each of these areas.
Okay, so it's not just aggregate, you have individual.
No, we don't have individual, it's spatial data on these, the economic features. So we can't get to that at an individual level, but we can make inferences for across the census block group or the census tract group.
All right, thank you, everyone. Christina, does that hopefully answer your question?
Well,
Okay, to some degree, maybe we can talk afterwards. I'm only cutting off because we're very, very short of time. But thank you again, Abigail, for your talk.
Yes, thank you.
thank you.
And with that, I think we'll see you later, and I'll see you at a little after 4, Abigail.
Great, thank you.
See you.
Thank you all.
All right, goodbye, everyone.